Hi everyone, my name is Aliza Shapiro and I'm a therapist here at the Center for Anxiety. I'm grateful to have this opportunity to tell you all a bit about the intensive outpatient program, also known as IOP, that we run here at the center. Very often when we think about the word therapy, we envision a standard once-a-week form of treatment where we come in and speak with a therapist about either a mental health challenge or life problem that we've been going through. For some of us, we've recognized that there have been points in our life that our anxiety or depression or challenges with mental health have been so big that we've almost felt like once-a-week therapy just wasn't going to cut it. For example, some of us may have recognized that anxiety, depression, OCD, or even panic disorder has gotten in the way of our life that we no longer feel like we can function. Maybe we've recognized that because of our depression, we can no longer get out of bed or have extreme difficulty even walking down the street and therefore getting to work. In these moments, it's very difficult to know what to do, and it can feel like once-a-week therapy just isn't going to be enough. And that's where IOP comes in. The intensive outpatient program is designed specifically to help individuals who feel like they are in a state of crisis to get through that crisis and get back to their everyday lives. The way that IOP is run is that each individual patient has one or two therapists that they work with on an individual basis from 1 to 3 weeks, anywhere from 3 days a week to 5 days a week, for a couple hours each day. IOP is designed to help you achieve the specific goals that you have in a very short amount of time so that you can, as we say, get back on your feet. In IOP treatment, you work with your individual therapist to determine what skills are going to be necessary for you to get back to everyday living, and we take a very behavioral approach using skills either from CBT or DBT forms of treatment. Therapists will work with individuals to come up with very concrete and specific goals that can be targeted within an IOP setting. Therapists and patients will then work together to learn the skills within the therapy room so that patients can ultimately go home and generalize these skills into their everyday lives. During treatment, we are sure to collaborate with family members, outside therapists, psychiatrists, or even rabbis or spiritual guides to ensure that various elements of everyday life are also being targeted. In addition, we use metrics and surveys to ensure that each patient is reaching the goals that they had set out to reach within IOP so that we can make the most of the short amount of time that we are in together. Once significant improvement has been made, an individual feels that they've hit their IOP goals and levels of distress or anxiety and depression have come down from that level of severity, we help individuals get back to everyday life and get back to standard outpatient treatment. I've had the privilege of working with many individuals in an IOP setting here at the center who have worked very, very hard and have also seen incredible results. I will add that IOP is not for everybody, but if you wonder if it might be for you, feel free to call us at the Center for Anxiety so we can talk with you more about it. Thanks so much for listening. Have a great rest of your day.